What's the best place to give a cat a vaccination or injection? Hi, I'm Dr. Marty Greer, Director of Veterinary Services with Revival Animal Health. There are two places to give a vaccination or injection to a cat: the back of the neck near the shoulder or in the lower leg. Some people may have heard that giving a cat a vaccination or injection in the scruff of the neck could cause a sarcoma, which is a kind of tumor. This is only partially true. It tends to be either the leukemia or rabies vaccination that causes this issue, or a long-acting antibiotic injection. So the recommendation for some of those is to give the injection in the lower leg rather than over the shoulder or back of the neck. A trick I use when giving a cat an injection is to use chicken Gerber stage 2 baby food, as we have here. A lot of cats will like this. It's a good distraction. Maybe some Cool Whip in a little bit of a dose here with a spoon, or this guy kind of likes cheese. So by doing this, we can give them a nice distraction so that they're thinking about something like their food rather than the injection. Sometimes putting them in a laundry basket can also help because it's going to keep them from moving around. The easiest place to give most cats an injection is to put them on an elevated surface, such as a towel on top of your dryer, on a countertop someplace, with a surface that doesn't slide around so that they're less likely to move around or jump away from you when you're trying to give the injection. So at this point, you're going to gently lift up some skin right over the shoulder, or in the case of the back leg, just over the joint in the lower leg. Just lift it up, make a little tent, take the cap off of your needle, slide the needle into the skin gently, pull back on the plunger to make sure that you don't get air or blood, and then do the injection. It's pretty easy. He doesn't seem to mind too much. And then it's an easy place to do. The problem with the back of the neck is medication tends not to be absorbed well from here, and it's a thicker skin, so it's more difficult to give through. In the lower leg, you'll just want to reach down here and have the cat gently and comfortably sitting on the table, lift up a little bit of skin, and again, just slide the needle through the skin, carefully not to put your needle into your finger, and pull back on the plunger and then inject.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number, and don't miss our other pet health videos.